You are probably taking a medication right now, one your doctor prescribed, one you've been on for months or even years, and it could be quietly draining one of the most important vitamins your body needs to function. I'm not talking about some obscure supplement. I'm talking about vitamin B12. And when your levels tank, you don't just feel a little tired. We're talking brain fog so thick you can't think straight, nerve damage, depression, memory problems, doctors misdiagnosing it as aging, anxiety, even early dementia. Today I'm going to walk you through 5 of the most commonly prescribed medications in the world and show you exactly how each one is interfering with B12 absorption in your body. Some of you watching this have been on these drugs for years without anyone ever warning you about this connection. By the end of this video, you'll know what to watch for, what to ask your doctor, and what you can actually do about it. But real quick before we dive in, if you're new here, welcome. This channel is all about giving you honest, practical health information that actually helps you make better decisions for yourself and your family. We are on a mission to reach 1,000 subscribers, and every single person who joins this community genuinely matters to us. So if you find today's video helpful, please hit that subscribe button and ring the notification bell. It costs you nothing, and it means the absolute world to us. Okay, now let's really get into it. Why B12 matters. Before we talk about what's blocking B12, let me take 90 seconds to explain why this vitamin is so non-negotiable for your health. Vitamin B12, also called cobalamin, is involved in 3 of the most fundamental processes in your body. 1. Your nervous system. B12 is essential for building and maintaining myelin, the protective sheath that wraps around your nerve fibers. Think of it like the rubber insulation around an electrical wire. Without enough B12, that insulation breaks down, and signals across your nerves start to misfire. 2. Your red blood cells. B12 is required for your bone marrow to make healthy, normal-sized red blood cells. Without it, you produce large, abnormal cells that can't carry oxygen efficiently, a condition called megaloblastic anemia. 3. Your brain. B12 plays a critical role in synthesizing neurotransmitters, including serotonin and dopamine. Low B12 has been directly linked to depression, anxiety, cognitive decline, and in severe cases, psychosis. Here's what makes B12 different from most vitamins. Your body can't make it. You have to get it from food, primarily animal products like meat, fish, eggs, and dairy. And the absorption process is remarkably complex. When you eat B12, it has to be separated from food protein in your stomach by hydrochloric acid, bind to a protein called intrinsic factor produced by your stomach lining, travel to the last section of your small intestine, where it's absorbed. That is a multi-step relay race. And every single drug I'm about to show you throws a wrench into one or more steps of that process. Now, let's count them down. Drug number 5. Drug number 5. Proton Pump Inhibitors, PPIs. Brand names you know: Omeprazole, Prilosec, Pantoprazole, Protonics, Esomeprazole, Nexium, Lansoprazole, Prevacid. If you've ever had acid reflux, GERD, or were told you had a stomach ulcer, there's a very good chance you've been prescribed one of these. PPIs are one of the most prescribed drug classes on the planet. In the United States alone, tens of millions of prescriptions are written every year, and they work. They dramatically reduce the amount of acid your stomach produces. For people suffering from real, painful acid reflux, that's a relief. Here's the problem. That stomach acid? It's not just causing heartburn. It's doing a critical job, breaking the bond between B12 and the proteins in your food. Without sufficient stomach acid, B12 stays locked to food protein. Your body cannot extract it. This is not a theory. This is documented in the medical literature. A landmark study published in the Journal of the American Medical Association found that people who used PPIs for 2 or more years had significantly lower B12 levels compared to non-users. The risk increased with both the duration of use and the dosage. 2 or more years. Think about how many people are on PPIs for 10, 15, 20 years, and nobody ever checked their B12. Who is most at risk from PP is plus B12 depletion. People over 60, stomach acid naturally decreases with age. Vegetarians and vegans, lower dietary B12 to begin with. Anyone with a history of low stomach acid, long-term users, especially those on PPIs for more than a year. What your doctor should be doing. If you're on a PPI long-term, your physician should be checking your B12 levels annually. If they haven't mentioned this, bring it up at your next appointment. A simple blood test, serum B12, or better yet, methylmalonic acid, MMA, can catch deficiency early. Important note, do not stop your PPI without talking to your doctor. There can be serious consequences to abruptly stopping acid suppression therapy, including rebound hyperacidity. Work with your provider. Drug number 4. Drug number 4. Metformin brand names. Glucophage, Fortamet, Glumetza. Metformin is the world's most widely prescribed diabetes medication. It's a first-line treatment for type 2 diabetes, and it's been used for decades. For many people, it's a genuinely life-saving drug. But it has a dark side that the diabetes community has been slowly waking up to. Metformin reduces the absorption of B12 through a specific and well-understood mechanism. In the final section of the small intestine, the ileum, B12 bound to intrinsic factor attaches to specialized receptors called cubolin receptors to be absorbed. This process is calcium-dependent. Metformin interferes with this calcium-dependent uptake mechanism. It essentially blocks B12 from being absorbed at that final critical gate. Studies suggest that anywhere from 10 to 30% of long-term metformin users develop measurable B12 deficiency. Some estimates go higher. What's especially alarming is the overlap of symptoms. Diabetic peripheral neuropathy, nerve pain, tingling, and numbness in the hands and feet is a well-known complication of diabetes. But B12 deficiency causes identical symptoms. So here's what sometimes happens. A diabetic patient on metformin develops tingling in their feet. The doctor assumes it's diabetic neuropathy, a consequence of the disease, when in reality, it's B12 deficiency caused by the medication treating the disease. The treatment for those two conditions is completely different. What you should know, the American Diabetes Association has formally recommended that patients taking metformin have their B12 levels measured periodically. If you're on this medication and no one has ever checked your B12, please ask. And if you've been diagnosed with peripheral neuropathy, push your doctor to rule out B12 deficiency before assuming it's purely diabetes-related. Drug number 3. Drug number 3. H2 blockers. Histamine 2 receptor antagonists. Brand names: famotidine, Pepcid, ranitidine, formerly Zantac, now off-market, cimetidine, Tagamet. You might know these as antacids you can buy over the counter, and yes, you can get them without a prescription. But they're also prescribed at higher doses for chronic acid-related conditions. H2 blockers work differently from PPIs, but with a similar end result. They reduce stomach acid production by blocking histamine 2 receptors in the stomach lining cells. Less stomach acid, which means, just like with PPIs, less ability to free B12 from food protein. The effect is generally less potent than PPIs. But here's why. H2 blockers deserve their own spot on this list. People underestimate them because they're over-the-counter. People self-medicate with Pepcid for years, daily, without ever thinking that a medication you buy at the drugstore alongside vitamins could be depleting a vitamin. Long-term, consistent use of H2 blockers, particularly at higher doses, has been associated with reduced B12 absorption. And because these drugs are often used by people who are also candidates for PPIs, the populations overlap considerably. The key question to ask yourself: have you been taking Pepcid or a similar drug every day for more than a few months? If yes, talk to your doctor. This isn't something to manage on your own. Interlude. I want to pause here for a moment because I want to be very clear about something. I am not telling you to stop taking your medications. I'm not anti-medication. Proton pump inhibitors, metformin, and every drug on this list have helped millions of people manage serious health conditions. What I am saying is this: every medication has trade-offs, and the trade-off of long-term B12 depletion is one that is routinely overlooked, even by well-meaning physicians. Not because they don't care, but because they're focused on managing your primary condition. You have to be your own advocate. Now let's continue. Drug number 2. Drug number 2. Certain antibiotics, specifically extended course or recurrent antibiotic use. Most impactful: tetracyclines, doxycycline, minocycline, chloramphenicol, and broad-spectrum antibiotics. This one is more nuanced than the others, so stay with me. Your gut microbiome, the trillions of bacteria living in your intestinal tract, actually produce small amounts of B12 themselves. The contribution to your total B12 levels is debated, but the gut flora do play a supporting role in the overall B12 ecosystem. When you take antibiotics, you're not just targeting the bacteria making you sick. Broad-spectrum antibiotics significantly disrupt the gut microbiome, killing beneficial bacteria alongside the harmful ones. But there's a more direct mechanism, specifically with certain antibiotic classes. Chloramphenicol, an antibiotic used for serious bacterial infections, has been shown to directly interfere with B12's role in cell production. It competes with B12-dependent enzymatic processes in the body. Long-term or repeated exposure can contribute to anemia that overlaps with B12 deficiency presentation. More broadly, extended courses of antibiotics, or being put on antibiotics repeatedly over months or years, disrupts the gut environment in ways that compromise nutrient absorption generally, including B12. Who this applies to: people with chronic Lyme disease being treated with long-term antibiotics, those with recurrent urinary tract infections on repeated antibiotic courses, patients who've undergone prolonged antibiotic therapy for H. pylori or other chronic infections, individuals who've taken doxycycline long-term for acne or rosacea. What to do? After any significant antibiotic course, consider probiotic support to help restore gut flora, and ask your doctor whether checking your B12 makes sense given your history. Drug number 1. Drug number 1. Oral contraceptives and hormone therapy. Most impactful: combined estrogen-progestin oral contraceptives, hormone replacement therapy, HRT. This is the one that surprises people the most, and it affects one of the largest populations on this list. Oral contraceptives, birth control pills, are one of the most commonly prescribed medications in the world. Millions of women take them, often for decades, starting as young as their teens. And hormonal replacement therapy affects millions of postmenopausal women. The research on oral contraceptives and B12 dates back to the 1970s, but it continues to be underappreciated. Estrogen-containing contraceptives appear to affect B12 absorption and metabolism through several pathways. First, they may reduce the concentration of transcobalamin 2, the protein responsible for transporting B12 through the bloodstream to your cells. B12 that can't be transported effectively can't be used by your tissues, even if blood levels appear normal. Second, combined oral contraceptives are known to deplete folate, B9, and B12 and folate work in tandem in many of the same metabolic pathways. Deficiency in one can mask or compound deficiency in the other. Third, some research suggests hormonal influences on the gut itself can alter B12 uptake efficiency. Here's what makes this particularly tricky. Women on the pill often have blood tests that show normal B12 levels, but a portion of that B12 is bound in a form that isn't biologically active. Their functional B12 is lower than the number suggests. This is why a methylmalonic acid test, which measures how your body is actually using B12, can be more revealing than a standard serum B12 test alone. For women on long-term hormonal contraception, ask your doctor to check both serum B12 and folate. Consider requesting a methylmalonic acid or homocysteine test for more accurate functional assessment. Maintain a diet rich in B12 sources, animal proteins, fortified foods, or discuss supplementation with your provider. Be especially vigilant if you're vegetarian or vegan what to do about it. So, what can you actually do? Here's your practical roadmap. Step 1. Know your medications. If you're on a PPI, Metformin, an H2 blocker, antibiotics long-term, or hormonal contraception, B12 monitoring should be part of your routine care. Step 2. Get the right tests. A standard serum B12 test is a start, but it can be falsely reassuring. Ask your doctor about methylmalonic acid, MMA, rises when B12 is functionally deficient at the cellular level. Homocysteine, also elevated in B12 deficiency, and independently associated with cardiovascular risk. Holotranscobalamin, active B12, measures the fraction of B12 actually available for cellular uptake. Step 3. Discuss supplementation intelligently. Not all B12 supplements are equal. Methylcobalamin is the most bioavailable form for most people. Sublingual, under the tongue. B12 bypasses the stomach entirely. Important if your absorption mechanism is compromised. B12 injections may be necessary for those with severe deficiency or absorption disorders. Do not self-treat without a proper diagnosis. Step 4. Talk to your doctor and be specific. Don't just say, "I'm worried about B12." Say, "I've read that my medication can interfere with B12 absorption. Has my B12 been tested recently? And would you recommend we monitor it going forward?" Step 5. Don't stop your medication without guidance. I'll say it again because it matters. These are serious medications for serious conditions. The goal is informed, collaborative care, not abandoning treatment that may be keeping you healthy. Your body is incredibly capable, but it needs the raw materials to do its job. B12 is one of those non-negotiable materials. When it runs low, the effects can be slow, subtle, and devastating, mistaken for aging, burnout, or depression, when the answer might be on a lab result that no one thought to order. You came to this video because you want to understand what's happening inside your body. That kind of proactive curiosity is exactly what keeps people healthier, longer. If this video was useful to you, share it with someone you know who takes any of these medications. They might not know to look. And if you want me to go deeper on any of these, the science behind B12 testing, the best forms of supplementation, or what happens when deficiency goes untreated, leave a comment below and I'll make that video. Take care of yourself. I'll see you in the next one.